Hi, I'm Dr. Langley with Pine Ridge Family Medicine, and I have had acne my whole life. I mean, as a teenager, it was really bad, just ran in the family. Every kid in my family had to go on Accutane or tretinoin, which is a pill that you take every day for your acne. It's related to vitamin A, and it's the only cure that we have for acne. It now goes by different names. Accutane was discontinued, but tretinoin is still the only reliable cure we have for acne. It's pretty amazing. It's strong stuff. It's really powerful. It's pretty miserable for the months to maybe a year or two that you could possibly be on it. And it's a brutal medication, but it does cure acne, so that's pretty cool. But another form of T-retinoin that is also really amazing is the topical form. So a cream or a gel of T-retinoin is one of my favorite go-tos for all sorts of skin issues. Anything from acne, which especially when combined with something that kills the bacteria, it can work really well to prevent future breakouts, to as you get older and you get less acne and more wrinkles and more age spots and things like that, or even acne scarring that never completely went away. T-retinoin can be amazing for getting rid of those and helping your skin to look younger. So it's something that I prescribe very often to all ages of individuals. I've had great luck with it getting rid of the darker brown age spots, especially on the face, and helps to smooth out some of the smaller fine lines that you get early in the aging process. Some of the downsides is that when you stop using it for any reason, that the effects do go away. You have to keep using it while you're getting the effects in order to get the effects. And although you should be using sun protection all the time to prevent sun-related damage to your skin, it's especially important if you're on T-retinoin because it will make you even more sensitive to the sun. It will make you burn a whole lot more easily. So every single day, honestly, whether you're on T-retinoin or not, you should be using some form of SPF. Even if you don't typically burn, you're still getting damage from the sun to your skin. So to keep it healthy and avoid cancer as much as possible, I really recommend an SPF every day. But T-retinoin, as effective as it is, it can be a little bit tricky to use because it does irritate your skin, especially when you first start it. And if you're on a higher concentration, it's more likely to irritate your skin. Feel free to, especially while you're first starting it, to use moisturizer as much as you need to help with the effects, the redness and flakiness, and the pain that goes along with getting used to having T-retinoin on your skin. Only use it twice a week if that's what you need, if that's how you can get used to using it, because your skin will become more tolerating of it with time. There's even evidence that the higher percentages, the higher potencies of T-retinoin gels and creams don't actually mean more of an effect. So that's an idea to chew over, to go with the one that's the weakest because it will be the less irritating to your skin, but it might just have, I mean, the studies are showing that it might have just as much of a good effect for getting rid of those things that you're trying to get rid of. So that's pretty cool. But the important thing is to stay on it. Unless you get pregnant. If you get pregnant, there is evidence that it might be bad for your baby. So stop using even a topical form of T-retinoin if you are pregnant. But otherwise, as long as you stay on it, you'll continue to reap the benefits of getting rid of that acne scarring, of lightening the dark spots related to sun use, and smoothing out fine lines. So it's a pretty cool medication. I've found that it also makes me have kind of flaky skin, especially first thing in the morning. And it makes it too sensitive to use like a scrub to get rid of that flaky skin. So I highly recommend gentle rubbing with like a washcloth to get rid of that flakiness, and then applying moisturizer first thing in the morning. And then that SPF, don't forget. And if you're finding it difficult to use an SPF every day, keep trying different brands. Something as simple as a nice smell can definitely make you more likely to use it every day, or having a tint to it so that it blends into your skin better and doesn't give you a white sheen. Can all make it more useful, more user-friendly, more likely for you to keep your skin healthy. So hopefully that's helpful. And if you're interested in another of my acne-related videos, they'll be posted right there. And feel free to please subscribe to me so you can find out about more videos that I release. Thanks for watching.